Before taking Zolmitriptan, make sure to read the Patient Information Leaflet from your pharmacist. Take this medication by mouth with or without food, as directed by your doctor, at the first sign of a migraine. The dosage will depend on your medical condition and other medications you may be taking. Do not take more than the prescribed amount in a 24-hour period. If there is no improvement in your symptoms, do not take more doses before talking to your doctor. If your symptoms are only partly relieved, you may take another dose at least 2 hours after the first dose. Some patients may be directed to not take more than 5 milligrams in a 24-hour period. If you have a higher risk for heart problems, your doctor may perform a heart exam before you start taking Zolmitriptan. And if you are using drugs for migraine attacks on 10 or more days each month, do not use medications more often or for longer than directed. Talk to your doctor if you need to use this medication more often, or if the medication is not working as well, or if your headaches get worse. Some common side effects of Zolmitriptan include tingling/numbness, nausea, dry mouth, weakness, drowsiness, or dizziness. If any of these effects persist or worsen, inform your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. Zolmitriptan may cause an increase in blood pressure, so it's essential to monitor your blood pressure regularly and inform your doctor if the results are high. If you experience any serious side effects such as blue fingers/toes/nails, cold hands/feet, chest/jaw/neck tightness, pain, or pressure that is not serious, it's important to contact your doctor right away. These side effects can resemble symptoms of a heart attack. Additionally, Zolmitriptan may rarely cause a very serious condition called serotonin syndrome/toxicity, especially if you are also taking other drugs that increase serotonin. If you develop symptoms such as fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe nausea/vomiting/diarrhea, twitching muscles, unexplained fever, or unusual agitation/restlessness, seek medical help immediately. While a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. Before taking Zolmitriptan, be sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's important to also discuss your medical history, especially if you have blood circulation problems, certain types of headaches, heart problems, liver disease, seizure, stroke, or if you have any conditions that may increase your risk for heart problems such as high blood pressure, high cholesterol, diabetes, family history of heart disease, being overweight, being a smoker, being postmenopausal, women, or being over 40 years old, men. This medication may cause dizziness or drowsiness, and consuming alcohol or marijuana can intensify these effects. It's important to avoid driving, using machinery, or anything that requires alertness until you can do it safely, and to limit alcoholic beverages. If you are using marijuana, it's important to talk to your doctor. Before undergoing any surgery, be sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that the risk of heart disease, liver disease, and high blood pressure increases with age. Older adults may be more sensitive to the side effects of this drug, especially increased blood pressure and heart problems. If you are pregnant, this medication should only be used when clearly needed, so be sure to discuss the risks and benefits with your doctor. It's also important to consult your doctor before breastfeeding, as it is unknown if this drug passes into breast milk. When taking Zolmitriptan, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Always keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking MAO inhibitors with this medication, as it could cause a serious, possibly fatal, drug interaction. This includes medications like isocarboxazid, linezolid, and phenelzine. Additionally, if you are taking other drugs that increase serotonin, such as certain antidepressants or street drugs like MDMA, the risk of serotonin syndrome/toxicity may also increase. It's important to talk to your doctor about the best timing for starting or stopping these medications in relation to your zolmitriptan treatment. If you are also taking any ergotamine medication or other triptan drugs, such as sumatriptan, you will need to separate your zolmitriptan dose from these medications to reduce the chance of serious side effects. It's important to ask your doctor how long you should wait between your doses of these drugs for optimal timing. If someone takes too much zolmitriptan and experiences severe symptoms like fainting or difficulty breathing, they should call 911 or a poison control center immediately. In the U.S., residents can call 1-800-222-1222 for their local poison control center, and Canadian residents can call their provincial poison control center. It's important to avoid sharing this medication with others. Certain foods, drinks, or food additives like red wine, cheese, chocolate, and monosodium glutamate, as well as lifestyle habits such as irregular eating or sleeping patterns, or stress, may trigger a migraine headache. Avoiding these triggers may help reduce the frequency of migraine attacks. Be sure to consult your doctor for more information. Your doctor may recommend lab or medical tests, such as checking your blood pressure, while you are taking this medication. It's important to attend all medical and lab appointments as scheduled. Be sure to consult your doctor for more details. Not applicable. See how to use section. This means that the specific instructions for using zolmitriptan can be found in the How to Use section of the medications label. It's important to follow these instructions carefully to ensure safe and effective use of the medication. It is important to store zolmitriptan at room temperature, away from light and moisture. Keep it in a place where children and pets cannot reach. Do not flush it down the toilet or pour it into a drain unless instructed to do so. When the medication is expired or no longer needed, it should be properly discarded. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.